Welcome to this special live town hall, Older Adults and Well-Being During COVID-19. My name is Dirk, the moderator for this call. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Layden are live and looking forward to hearing your thoughts as we take on this community conversation. Also joining and looking forward to answering your questions are Dr. John Douglas, Executive Director of Tri-County Health Department, Ayla Cook, Social Worker and Older Adult Specialist with All Health Network, and Debbie Haney, Executive Director of the Castle Rock Senior Activity Center. Now, when we get to the Q&A portion of this call, if you have a question you want to ask, please press *3 on your telephone keypad. Again, press *3 if you have a question you would like to ask. We know everyone has lots of questions. We'll get to those very soon. But first, we'll hear briefly from your commissioners. Commissioner Partridge, please get us started.
Thank you, Dirk, and good morning, everyone. Hope everybody is doing well on this little chilly morning. Today, we really look forward to hearing from the older adults and find out the particular ways that older adults are impacted by COVID. We know we have some wonderful information to provide you, and we look forward to your questions. I believe they'll be answered from our experts in a very appropriate way. Thank you, Dirk.
Thank you very much, Commissioner Partridge. Commissioner Thomas.
Good morning, everybody. It's a pleasure to have you all here with us today. We're really looking forward to hearing what your kind of questions are all about. You know, my mom is 87 years old. She lives in an independent living facility, and this has been hard on her, but she has had a great attitude, and she has really made sure that she would be optimistic every morning when she woke up. So I think that she probably reflects a lot of how all of you have been taking all of this, but you live in the healthiest county in the state. And so we were already a little bit better off than all the other counties. So I'd like to welcome you on this call, and we will be taking calls and questions about older adults and well-being of those, of all of you. So we're looking forward to hearing your questions. Thank you, Dirk.
Thank you, Commissioner Thomas. And Commissioner Layden.
Thank you so much, Dirk, and thank you to my fellow commissioners. I think it was said well that the well-being of older adults is top of mind for all three of us. You know, I have a mother with an underlying health condition that is being very cautious right now and is limiting in-person contact out of concern for her own safety and for that of others. I also have a father-in-law that's approaching 90 that really makes seeing his grandkids a priority. And he's making decisions around how to do that safely and well. And ultimately, we just respect and honor the decisions of each individual with that personal responsibility in light of the science and the data that's driving all of these public health decisions. But whether you are in a care facility or you're thinking about the upcoming holidays, we're here to answer your questions. And we're excited to just have this dialogue about how to best help with the lives of older adults.
Thank you very much, Commissioner Layden. Now, as a reminder, if you have a question that you would like to ask and you're listening to this conversation on your telephone, all you need to do is press *3 to enter the question queue. Again, if you have a question you would like to ask and you're listening to this conversation on your telephone, please press *3. Now, if you're listening through the website at douglas.co.us/town hall, you can enter your name and question below the streaming player. Right now, let's get to Dr. Douglas. We'll start by hearing from you. Can you share an update on COVID-19 in Douglas County and the impacts we're seeing?
Sure. Good morning, everybody. Great to be with you. Thanks to those who've joined this morning. Really appreciate Douglas County organizing these town halls periodically, which gives us a chance to hear concerns from the community and provide information. And I am grateful for those of you who are here to learn new information. I do think the more informed all of us are about where things stand, what are the facts, what are the fictions, et cetera, about COVID, the smarter we can be to exercise the sort of personal responsibility Commissioner Layden referred to in living our lives as safely as possible. let me say a few things. First of all, as you are probably aware, Colorado is experiencing increases in numbers of cases of COVID. This has been something that's happened since early September. This is not unique to Colorado. It's happening across the country. We are experiencing the Colorado trend in the metro area and also in Douglas County. As Commissioner Thomas said, Douglas County does have the benefit of being baseline a very healthy place. And because of that, the rising cases in Douglas County has been less than in other counties. And the number of people with severe outcomes, and we measure severe outcomes by the numbers being hospitalized or even folks who end up getting so sick that they die, those numbers have remained very low. So that's really good news. I will say, though, as community transmission rates go up, and we're mostly seeing those transmission events and new cases happening in folks in their 20s and 30s and 40s, there is the possibility for infection to trickle into other groups. And I pay particular attention to groups like those that we'll be talking about this morning, our older population, since they are at risk of getting more severe complications. And I also pay attention to the other end of the bookend, the younger population, since they don't get nearly as sick, kids don't, but their getting COVID can impact our ability to run our schools effectively. So I look at the bookends as being important, really important for two different reasons. I think one of the things I'm most pleased about is that many of our folks who are vulnerable, and when I use that term, I mean those of us that are over 65 or those of us that have various underlying health conditions, diabetes, obesity, heart disease, lung disease. I think those folks are being more careful, which is really good, because it really, their best line of defense is protecting themselves and being educated about the illness, how the infection is transmitted, so they can take appropriate steps. And you've probably heard this until you're fatigued with hearing about it, but the key steps that we can all take is when we are around other people is to try to maintain a social distance of 6 feet or so, that even though the holidays are getting closer and we're all tempted to wanting to enjoy them with our families, the more we can enjoy large gatherings, the better. Thirdly, we do believe that the regular use of face masks can be really important, both in terms of preventing transmission to other people from you, but also to protect you from other people. We've been preaching hand washing since the beginning of the epidemic, and that remains important because hand-to-nose transmission can be important. We continue to emphasize that if you're sick, please stay home. You could have COVID, and we don't want you to spread it. And if you have symptoms that could be compatible with COVID, we want you to encourage you to get tested, because then you have knowledge to be able to act and conduct your life carefully to try to avoid exposing other people. And then I don't want to hammer this home too much, but again, if we do have one of those conditions that can put us at greatest risk, we got to continue to be really watchful and careful about it being exposed to other people. I want to acknowledge, I'm not ready yet to call it an epidemic, but it's a real phenomenon. And I want to acknowledge that we're all kind of tired of living with COVID. It's been coined COVID fatigue. You know, we all hope that this problem would be gone by now, and it's not. And although I do think I see light at the end of the tunnel, we're not there yet. And the winter will bring less sunlight, darker days, colder weather, more need to be inside. And every respiratory virus we've ever dealt with gets worse in the winter, because indoor circumstances with less good ventilation is where transmission can really be exacerbated. So I think we've all got to be really thoughtful about that, whether it's, you know, your family's wanting to do something around Halloween or Thanksgiving or Christmas or New Year's. Those are particular times where we can begin to see transmission events happen. We've been looking very carefully when we interview people who've been diagnosed with COVID, which we try to do for everybody, really, so we can make sure they protect themselves and protect other people, that the most common sites of exposure appear to be personal gatherings. people getting together for birthdays and anniversaries and baptisms and sometimes funerals, or other events that are just a natural part of human experience. But we are realizing that that's the place that we seem to be most vulnerable as a community. And that's a place that we're working to try to help educate all of us as effectively as possible. A last word I want to say is about vaccines. Election day is only 10 days away. We will not have a vaccine by Election day, but I am very encouraged by what I hear about the progress in the development of vaccines. I think it's not implausible that we'll begin to see some of them used before the end of the year. I don't think we'll be getting vaccines into broad use until the spring, maybe the late spring. And we don't yet know whether the vaccines that are being tested now will work equally well in all populations. For example, we know that some vaccines don't work as well in older people. So we're going to be keeping a really close eye on that. But I do think the progress that's been made in that area, which I really think is going to be our major pathway back to normalcy, is moving along very rapidly. And while I always am cautious in my optimism, I am cautiously optimistic. Thank you.
Thank you very much, Dr. Douglas. And as a reminder, the focus of this call is on older adults and your well-being during COVID-19. We have a number of professionals here ready to answer your questions. So if you have a question you'd like to ask, please press *3 on your telephone keypad to enter the question queue, or you can send your question through the website at douglas.co.us/town hall. And it's time to get to questions. So it looks like, Dr. Douglas, this is a good one for you, since we're going to talk about contact tracing. And Mary wonders, what can I expect from Tri-County if they determine I've been exposed to COVID-19 through contact tracing?
So thanks, Mary. I really appreciate your asking it, because that is one of the vital components of our being able to try to help turn the corner and bring infection rates back down. We need to test folks that are sick. We need to talk to those who are diagnosed as positive so we can help them stay isolated, find out who they've been exposed to. And then if you're one of those contacts, what we'll do is contact you, call you, and discuss with you the nature of what we believe to be your contact. Let me emphasize, we're not going to ask you for any personal information such as social security number, credit card, financial information, your residency or immigration status. We only ask information relevant to actually helping you protect yourself and helping us understand community transmission. And I only mention that because there have been some scams, and those are things that we really want to have people aware of, that there are people impersonating us that's creating confusion. When we do talk to you, what we're going to ask you about is where you were during various points in time. Are you sick, by the way? Have you already developed symptoms? And if so, how can we help you get tested? And then if you are sick, have you been exposed to other people? Finally, we want to talk to you about what it means to stay in what we call quarantine. Quarantine refers to a setting where you've been exposed to a contagious disease, you're not sick, but you could get sick. And the idea is that you stay away from other people during a time when you could be incubating the infection. So we'll sort of coach you along on what it means to live in quarantine. If you share a house with other people who might not have been exposed, how do you kind of quarantine yourself from other people? It's very situation dependent, and our team tries to walk you through what will work most effectively in your circumstances.
Thank you very much, Dr. D. Moving on to a caller, we've got Georgie, who is thinking about Thanksgiving. So welcome to the call, Georgie. Hear your question, please.
My daughter moved here from California recently and wants me to move in with her. I'm 90 years old. I've been living alone. I'm diabetic. I've been very careful, and I know she wants me to be in her home during Thanksgiving and probably have some other relatives visiting. And I've been staying alone so carefully and don't want to lose that safety that I have built up. Should I move in with her before there is a vaccine? And should I get together with her for a group Thanksgiving get together?
Georgia, that's really important situation, important question you're asking. I'd say the following about both moving in as well as being with others. I think if your daughter has taken precautions and you feel relatively comfortable that she has not been exposed to infection, I think it would be reasonable to move in with her if her lifestyle is such that she's not going to be in circumstances where she could bring infection home to you. For example, if she's working in a retail department store where she may be around a lot of people and could be exposed, I'd be a little more concerned about that. One thing that you could do and she could do to reassure both of you that when you begin to consider this, that she's not a risk to you, is to get tested. We do encourage people who have been potentially exposed that may be around vulnerable people, and someone who's 90 is honestly a vulnerable person, to get tested to be sure that any past contact they've had won't result in a new, or hasn't resulted in their being infected and not knowing it. And this is a time to remind all of us, about 40% of people at the time they transmit infection don't have any symptoms at all. They feel great. And that's why we recommend masking. I think I'd have to tell you to be quite cautious around family gatherings at Thanksgiving. The head of the National Institutes of Health, Dr. Francis Collins, announced the other day that he's doing a Zoom Thanksgiving with his family. That after 25 years of Thanksgiving get-together, they're not going to do it. And I would say that I'd be very careful if it's more than just a handful of people and everybody's not wearing masks. I think, again, given your age, I'd want you to be quite cautious about those kind of gatherings.
Thank you, Dr. Douglas. Our next caller looks like a question for you as well. Diana, welcome to our call. You are live. Go ahead with your question for the doctor, please.
Good morning. I recently received a summons for jury duty in November. A few weeks after that, I will be 70. My husband will be 74. He has congenital heart disease, and he's pre-diabetic. We live outside of town. We have been wearing masks and social distancing. Is this something that I can get out of to go to jury duty? Because I'm living with him, I'm the caregiver.
Diana, that's a really good question. I don't know the definitive answer to it. It's been my impression that the courts that organize the collection of jurors do pay attention to details like that. What I would encourage you to do, I do know our courts are being quite careful. They've taken many steps to try to prevent transmission inside the courtroom. But I think you've got a pretty good individual circumstance where you yourself are in an older age group and you live with someone in an older age group and that person has a cardiac condition to request that you not be included. I can't tell you exactly what to expect. I do think the courts, again, have taken lots of efforts to be safe, but I think you've got a pretty good reason to try to ask to be excused.
Thank you very much, Dr. Douglas. And as a reminder to everyone listening in on this call, if you have a question you would like to ask, please press *3 on your telephone keypad. Again, *3 will take you to the question queue. You can also send your question through the website at douglas.co.us/town hall. Matter of fact, here's an online question. This one comes from Michael, and Dr. Douglas, this one's for you too. Family members want Thanksgiving get-together with 10 to 20 people. What do I do?
Michael, thanks for asking that question because lots of us, and by the way, my family is included, are considering that very question. I think this is the year to say we've had a great streak. We want to renew that streak in the future. This is not the year to have that kind of gathering. If most among the 10 to 20 are younger. And honestly, I'd worry about folks gathering in that sort of number of groups really in any circumstance. They would be somewhat more safe if you're older, having called into this town hall. I think you really ought to politely decline. I would point out that there are restrictions on personal gatherings under state orders, and currently Douglas County is in a category where you can have that many people gather together, but many of us have sort of forgotten that part of the attempts to try to control transmission is to limit the size of personal gatherings. And so if your family is making that plan, just be attentive to where the county stands. Right now, personal gatherings of up to 25 are okay in Douglas County, but if rates continue to go up, they may drop. The next level would take us down to 10. So for you, I think I'd politely try to zoom into the event, and for the rest of your family, really pay attention to those levels of recommended gathering size.
Thank you very much, Dr. Douglas. And a reminder, on the call with us today, we also have Debbie Haney, Executive Director of the Castle Rock Senior Activity Center. So I'm going to throw it out to you, Debbie. Do you have any ideas for seniors to celebrate Thanksgiving and the coming on holidays?
Hi. I would recommend, like Dr. Douglas has suggested, the Zoom or some type of FaceTiming events that you can do with your family and friends. There's a lot of options out there of playing games along with enjoying each other's company. And then just a good old conference call if you do not have the capability of the computer.
Perfect. Thank you very much, Ms. Haney. I appreciate your input. I'm sure we'll be calling on you for more answers here in the near future. But quickly, I'd like to remind everybody this is an interactive call, and we'd like to do a quick poll question, which we're looking for your input on. You'll use your telephone keypad to answer this poll question. And here is the question we're looking for your input on. Have you participated in previous Douglas County live town hall events? If the answer is no, this is my first time participating in these events, please press the number 1. The answer is yes, you've participated in one or a couple previously, please press the number 2 key. If the answer is yes, I've participated in several of these events, please press the number 3 key. So again, this poll question we are looking for your input on is, have you participated in previous Douglas County live town hall events? Press 1 for no. This is my first time participating in these events. Press 2 for yes. I have participated in one or a couple previously. And press 3 if it's yes, I've participated in several of these events. So thank you very much. I noticed that the poll is populating. We appreciate your participation. And again, if you have a question that you would like to ask, please press star 3 on your telephone keypad, and you'll be taken to the question queue to ask your question live of our experts. Moving on, we've got a question now from Susan. And Ayla, this one's for you. Many of my older friends can't be with their families and friends. How can I encourage them to have social interactions while still maintaining physical distancing?
Hi, Susan. Thank you for your question. So first, I would absolutely encourage some conversations about the type of social connections that they'd like to have, and different ways that they can build or change them while maintaining that physical distancing that we've been talking about. One way you can do that is you can help them by building a connections plan, which is basically an outline. It can give them an idea of ways to reflect on their current relationships, what they like about them, what they want in some future relationships, and some strategies on how they can build that. And also encouraging different levels of connections. So there's superficial connections, there's deeper connections, and both can be very fulfilling. So, for example, if superficial connections would be something that they would be more comfortable with, then that would be more like maybe getting a pen pal, waving at some neighbors, finding some interactions that aren't as intimate. If they're looking for deeper connections to build, then they can find ways to reconnect with people in their community, their families, their friends. They can even find volunteer positions that, again, can still protect that physical distancing. Maybe they can do some volunteer over the phone and do some phone check-ins with people. But really, it's about finding what best meets their needs, their moods, and their circumstance, and supporting them around that.
Thank you very much, Ms. Cook. And Ms. Haney, we'll have the same question for you. Get your input, please.
I had a couple more thoughts on the getting together for the holidays. This would be also a great time for grandparents to share traditions with family members, such as sharing and cooking recipes together via Zoom. You know, just because you're not together doesn't mean you can't be together in a different way and still share those special traditions. Here at the Castle Rock Senior Center and with Douglas County Aging Resources, we are providing reassurance calls. So if you know of seniors that need somebody that needs to be reached out to and just have that connection, contact Aging Resources of Douglas County, and we can connect you with a volunteer that would be love to talk with you and just share some time and get to know you better.
Wonderful. Thank you very much for that input, Ms. Haney. Back to the phones now. It looks like a question for Dr. Douglas. It comes from Terrence. Terrence, welcome to the call. You are live. Go ahead with your question, please.
Hi, doctor. My daughter had a son, so I'm a grandparent in May, and I've got an 85-year-old my mother, great grandmother, and you know we've done the Zoom thing and all that, but I'd really like her to come out and meet her great grandson at some point, and I'm just struggling with how to go about that safely and when I might be able to get that done.
So Terrence, that's a tough situation. Congratulations, by the way, on your grandson. It's great being a grandfather. I can share with you. I think right now is a challenging time. So what are your options for your mom to get to come out here? She could fly. I think our airlines have actually done a really good job, especially those that are able to allow flights without a middle seat. But I can tell you from personal experience, having flown recently, that the points of vulnerability are probably the airports, especially coming in, checking baggage claim, this kind of thing. There's lots of people, and it's really tough to space out. So I'd have to tell you right now, given how infection is increasing across the country, I'd want to be careful about that. I mean, I do want to acknowledge what Commissioner Layden said earlier, is that different people are going to make different judgments about pros and cons of particular actions. And I think that individual choice is really important. And maybe your mom so badly wants to see her great-grandchild that it's worth it to her. But I'd say that in general, I'd be sort of concerned about the flight. You could fly out there with your new grandson, or your kids could, but once again, that involves folks being exposed on an airplane. A third option, and I've got relatives in Virginia, and I've thought about this, is driving there. And, you know, that's a long drive, a couple of thousand miles to get out there. Probably safer, honestly, for the Colorado folks to drive to Virginia than to have your mom, unless she's got someone driving with her. I'm not being very optimistic, I'm afraid, in terms of giving you great options, except I would say those are kind of the realities for you to put into your calculation. And then I'd encourage you to pay attention to how transmission trends are going on across the country. If we get as low as we got in August, I think it would be relatively safer than what I'm afraid we're going to see over the next couple of months. So process the information and, again, try to come to what you all think is the best choice for your family.
Thank you very much, Dr. Douglas. I've got another caller here that's wanting some parental advice, and I think it's right up your alley as well, Doctor. Purvish, welcome to the call. Go ahead with your question, please.
Yes, my parents, my mom is 85 years old and my dad is almost 90. They just came back from India and we quarantined them for almost 2.5 weeks. There are no symptoms. Everything is looking good. However, I wanted to find out if they do start getting any symptoms, what are the steps we can take and what should we do immediately if the symptoms happen over the weekend or any other time?
So really important question. I'd say a couple of things about that. First of all, I hope they stay well. I'm glad they made it back to you from India. That's proof actually that you can fly safely, and that's obviously a really long trip. If they do get symptoms, the first thing I'd suggest is try to have them isolate from others in your family as much as possible. That's really tricky, but if you can prevent other people from being exposed, if they do happen to have COVID, then that makes the situation better for everybody. Secondly, I do think it would be good to try to get them tested as soon as possible. Our website lists a number of different testing locations across Douglas County, and if they don't have a primary care doctor yet, by the way, I would strongly encourage you to try to help them find one, because then that would be kind of a go-to place. Some of our primary care clinics are doing testing, and others can refer you to being tested. When you do get the test or figure out a place to get tested, ask them how long it is typically taking for the test result to come back. Currently, we're in pretty good shape. The tests are coming back within about 48 hours, but sometimes that changes. And if the clinic you're referred to says, well, it's been pretty good, but the last 2 weeks it's 8 days, I try to find another place, because you want to get results back more quickly than that. And then if their symptoms do begin to worsen and they begin to develop particularly any problems that appears with breathing, then I do think you want to call an urgent care or emergency room, discuss your concerns. They'll probably have you bring your parent in. So isolation, quick testing, and if they do get sick, a low threshold to try to get them attended to with emergency care.
Thank you, Dr. Douglas. And a reminder to everyone listening in on the call, if you have a question you would like to ask, all you need to do is press *3 on your telephone keypad to enter the question queue. Again, press *3 to ask a question. We've got an online question now submitted by Mike, who says, I'm 71, in good health and active. Where do opportunities exist to come alongside other seniors in need as a volunteer? Ms. Haney, your thoughts?
That's great. We definitely have opportunities here at the Castle Rock Senior Activity Center. We are providing the Meals on Wheels for all of Douglas County out of our center, along with a hot meal program that we are doing curbside and delivery to seniors that are still at home. I know Aging Resources also has a need for volunteers, also with care packages, reassurance calls, and some other different projects that we have that will be coming up through the fall and winter. So contact either Castle Rock Senior Center or Aging Resources of Douglas County. We would definitely love more volunteers that can help us. So thank you.
Thank you very much, Ms. Haney. Moving back to the phone, the call looks like Dr. Douglas, you're the person for this. It has to do with Halloween. So Dan, welcome to our call. Go ahead with your question.
Yes. It's concerning trick-or-treating. Normally, the wife and I go with the grandkids and the family out after our granddaughter's birthday, which is also on Halloween. I've kind of been suggesting against it, so I'm looking for your opinion on the safety and whether or not we should participate in Halloween this year.
So Halloween's coming up rapidly, of course. I just looked at the weather forecast. It's supposed to be in the 60s and sunnies on Halloween, so we won't have a snowstorm that's going to put us out of commission. I think your question is a really important one. We have not, and I don't know of any municipality in Colorado that has done anything like canceling Halloween. However, we have issued some guidance about how to do it safely. I think the biggest concern in Halloween, Dan, is folks getting gathered in groups together, especially if it could be indoor settings. So if part of your family's tradition has been sort of an indoor gathering with a number of people, I'd really be very careful about that. I do think that small groups moving and carefully distancing themselves from other people can safely do trick-or-treating. I think the question is, if you go to the really hot street in your neighborhood and there's 200 kids crammed together, that's not going to be so safe. So once again, I guess what I'm doing is laying out parameters of things that I would think about. I'm going to personally, by the way, be facing this question as a grandfather. I'm going to look at the weather. I'm going to look at the how we can distance ourselves. I'm not going to be out very long. And if it looks really crowded, I'm probably not going to go out at all, just because I do think that kind of close contact can create problems. So I wish I had a clearer answer. One clear answer would be to cancel Halloween. We're not going to do that, which means that we each have to kind of assess the circumstances and make a good choice.
Thank you, Dr. Douglas. Moving on this call, we have Ayla Cook, an older adult specialist with All Health Network. And Ayla, this question comes to you. It was sent in by John, who says, when I talk to my mother, she seems to be more frustrated and hopeless as time has gone on due to physical distancing protocols. How can I help her get through this?
Hi, John. Thank you so much for your question. First, I would encourage you to validate the experience that she's having. This is a very real experience. Her feelings are real, and it's very difficult to go through. I would also say don't try to counter that experience by offering false reassurance. For example, like giving a false hope of, this should all be over in a month or two. That can really be more difficult to come back from later. So again, coming back to just validating the experience that she's having and providing some companionship, asking questions like, what can I do that would be helpful for you? And also just encouraging, I can't change the situation, but I can be in this with you. This can also be helpful through, phone check-ins. I know that we've talked about that a little bit earlier in our conversation, that we can have some phone check-ins, writing letters. You guys can partner in an activity together, like reading the same book or completing some puzzles. But really, I would encourage that you would explore her resiliency and ask about some previous situations that were difficult that she overcame and how she did that, and that she has helpful approach to assisting her with navigating this really hard life circumstance. And lastly, I would also encourage, if you're concerned that she's having feelings of hopelessness or sadness, and maybe it kind of feels a little beyond what you would feel comfortable with stepping into, feel free to contact our services at All Health Network. You can contact our team. And also, you can check in with her and see if she would be comfortable with meeting with a mental health professional who can give her some tools that she can use on her own.
Thank you very much for sharing that answer with us, Ayla. And next, we're moving off to the phone, and this one looks like a good question for Ms. Haney. So Renee joins us now. Welcome to the call, Renee. Go ahead with your question, please.
You had mentioned about volunteering for Aging Resources to help out. Where is it that, is there a number that we could call, or where is it that we contact?
Great. Yes, Aging Resources phone number is 303-814-4300. And you can also call us too. Another avenue or area for volunteering is we do need drivers. Both of our services do provide transportation to seniors that no longer drive to get to the doctor's office. We also do grocery shopping for seniors, picking up prescriptions, and then quality of life trips just to go get their hair cut and some of those types of things. So again, Aging Resources number is 303-814-4300, and also Castle Rock Senior Center, 303-688-9498. You can also go to mydugcoteseniorlife.com, and all of these resources are on that page also.
Perfect. Sorry to step on you there, Debbie. I thought you were just giving the number, but giving the web address is a bonus for us all. Thank you very much for that. So next we've got a question regarding COVID testing. Actually, a couple of people are wondering about this. So for Dr. Douglas, regarding testing, Molly has heard of false positives and false negatives. What is the accuracy of the testing at this point? And what is the procedure for going to the drive-up COVID testing? Do you have to have a referral? Is something that Candace wants to know. So can you answer both those questions, Doctor?
Yeah, sure. The testing questions are really important. First of all, regarding testing, I think it's important to know that we've got an increasing array of opportunities. The mainstay test has been the PCR test. That's a genetic test. It's sort of considered to be the gold standard. And we think that test is, in general, greater than 97% sensitive. And sensitivity means if you really have COVID, your chance of getting a false negative test is less than about 3 to 5% or so. Not perfect, but highly accurate. We think with the PCR test, the chance of having a false positive, meaning that you've got a positive test, but you don't really have infection, is quite low as well. The only exception being, we think that virus can persist and be detectable by PCR in someone who's already recovered, and therefore we don't recommend testing as you're recuperating because you may get a false positive result in that setting. The more rapid tests that are more widely available, which I really like, and I really like them because they can give us results within a half an hour to 45 minutes, are not quite as sensitive. That means, again, you may have more false negatives. However, they are highly specific, meaning if it's a positive test, you can take it to the bank, that's real. So if you're symptomatic and you want to get a quick test, a rapid test is a good option. However, if it's negative, just be aware you might need to go and get the second PCR test. I think the other question was around the drive-up facilities. Check each one before you go. There have been different ways of organizing that. They all have websites that have pretty up-to-date information. In general, you do not need an appointment. You do not need a referral. And in general, they have been able to offer their services for free. But we try to keep up with that information on our website, which I mentioned earlier. But I would check before I go because, again, sometimes rules change. And frankly, sometimes they even get full capacity and they aren't open that afternoon because they had too many people in the morning. Did I get everything, Dirk, or was there a question I didn't address?
No, you did. You summarized everything and answered it all. Thank you very much, Doctor. And also thank you to Debbie Haney, Ayla Cook, the Board of County Commissioners, and everyone who's joined us today. We do have time to take a few more questions. And Dr. Douglas, this is another one for you. Amy wonders, do we need to have a COVID vaccine in order to be safe to engage in regular activities again?
Really important question, Amy. I'd say that as a general overall comment, for society to be able to get back to behaving normally, i.e. the way we behaved in 2019, I do think we need wide use of a highly effective and safe vaccine. Now, having said that, there are individuals who get exposed to COVID who are likely to be immune for some period of time. The question is, how long is that period of time? Some people say it could be 6 months or longer. Some people think it could be as short as 3 months. Part of the problem is, of course, COVID's only been around for about 8 months, and we don't really have a long enough information to know that. I think that what's likely to play out is that we're going to be seeing broad availability of reasonably effective vaccines sometime maybe in late spring. I think that we're going to begin to be able to relax. We're going to see case rates fall. We're going to be able to relax some of the painful, annoying restrictions that we've had to learn to live with. I think we probably will want to keep using our masks only because there will still be some transmission. And so I guess what I'm painting as a picture here is that it won't be like a light switch, that the vaccines are out and about in the middle of April, and by May, we're back to normal. It's going to take a while for those vaccines to actually get used in large enough numbers of people. They're, for the most part, 2-dose vaccines. That means you've got to go back a month later and get your second dose. So it'll be, I think, an ever-improving situation, but one that'll be gradually and not suddenly back to normal.
Thank you, Doctor.
Dirk, can I add to that?
Yes, ma'am, please.
I just wanted to share about the activity piece. Regular activities. There are a lot of activities that are going around for seniors. Douglas County has 3 great senior center active adult centers, one in Highlands Ranch, one in Parker, and then ourselves. And all 3 of us are providing virtual activities, take-home activities, some parking lot activities. We've had concerts, movies, webinars, trivia events, conversations, like I said, take-home kits. So I would really highly recommend going back to that my Dougco Senior Life page, and you can connect to the 3 senior centers and see what activities are there to do during the winter and the fall this year. So there are things that they're not regular, but there are a lot of fun activities to get involved in.
Thank you for that additional information, Ms. Haney. Now, Ayla Cook, this question's for you, submitted by Dave, and it's, I know connection is important to helping me manage my stress, but I don't always feel like talking to people. Are there other things I can focus on to help me cope with the pandemic?
Hi, Dave. Yeah, there are absolutely some other things you can focus on that would be helpful. I always like to bring up the 4 M's, which is mindfulness, meaningful connection, which we've talked about a little bit, movement, and mastery. So just a quick overview of, mindfulness activities. They can help you stay engaged. You can practice some stress management. Again, it's something that can help you improve resiliency, and you can build up some positive self-talk. Building up some meaningful connections, and I know Debbie just spoke a little bit about if you want to get connected and get involved with something in the area, you can take a look at things online and find out what connections you can be involved with that would be comfortable for you. Movement is going to be helpful as far as being physically active and stretching. It's helpful to prevent restlessness. And again, it's also helpful for stress management. If you're not really sure about what activities you'd want to do, you can always take a look at some apps you can download or even YouTube. You can take a look on YouTube and find some videos that can guide you in some activities. And mastery, you can find activities that can exercise your brain, finding some puzzles, some word searches, brain games that are stimulating. The great thing is that this isn't a one-size-fits-all approach, and you can really choose what works best for you and your needs.
Thank you very much, Ayla. And thank you to everybody on the call for submitting those very thoughtful questions. And now, let's hear one final time from our presenters, Debbie and Ayla, with the information of how people can reach out and access the resources you've mentioned today. Debbie, we'll start with you, and I promise not to step on you this time.
Oh, no, you're no problem. and I won't slaughter this. It's mydugcoseniorlife.com. I'm going to say that one more time. mydugcoseniorlife.com. And you can get all the resources, aging resources, Highlands Ranch Active Aging, Parker Senior Center, and Castle Rock Senior Center. I also want to, also Human Services Call Center also can help with needs for seniors. So if you've got questions, reach out to us. Let us help direct you, find you something fun to do, stay engaged, stay active. We're here for you guys. So thank you.
Thank you very much, Debbie. Ayla?
Hi. Yes, you can reach us at allhealthnetwork.org/Colorado-Spirit. If you have questions that you would like to send to our team, you can also email us at cospirit@allhealthnetwork.org. We also have a Facebook page. We've uploaded some videos. We have our Tuesday Talks and a couple of other videos that we've uploaded for the public to take a look at and get some self-care and mindfulness tools. So you can take a look at our Facebook page at facebook.com/AHN Colorado Spirit. Our phone number is 720-707-6789. And if you are in crisis and you need immediate help, again, feel free to call 911 or you can contact our Colorado Crisis Hotline at 844-493-8255, or you can text TALK to 38255 and speak with a trained professional.
Perfect. Thank you very much, Ms. Cook. And earlier in the call, we talked about fraud, and I'd like to repeat the hotline if you're concerned or wish to report fraud. The hotline number is 720-874-8547. So again, 720-874-8547. If you wish to report fraud, that is the hotline. So hopefully we're able to answer your questions about older adults' well-being today. We do invite you to submit any questions you may have about other topics to douglas.co.us/citizen-connect. That address again, douglas.co.us/citizen-connect. Before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final thoughts. Commissioner Partridge, we'll hear from you first.
Thank you, Dirk, and thank you everyone for joining. Your questions were real life, they were timely, and hopefully the answers you received were informative. I tell you, I learned something every time. I really appreciate the professionals, Ms. Cook, Ms. Haney, and Dr. Douglas being on the line, and hopefully our citizens with this can do everything they can to keep themselves healthy and help prevent the transmission, because that is one thing we certainly want to be able to do, not only in our county, but statewide, is see less and less cases. And with the self-responsibility that we all have that opportunity to take, I think we can make that change. So thank you, everyone, and God bless.
Thank you, Commissioner Partridge. Commissioner Layden, your final thoughts, please.
Well, thank you, Dirk, and thank you to all of our guests as well. You know, I just want to say to everybody out there, keep it up. You are doing such a phenomenal job. We've talked about this being a marathon, not a sprint. Maybe we're at mile 16 or mile 17, but you got to pace yourself. And I think people out there are doing a great job of being creative and thinking of ways to engage, especially our senior adults. You know, we know that more than 50% of the deaths in Colorado due to COVID-19 have occurred in residential care facilities for seniors and people with disabilities. And I just wanted to indicate that for those that are in those facilities that may be listening and may be older adults, compassionate care visitation may be allowed to provide personal medical and emotional care For those that are experiencing a real sharp decline in their overall health and well-being due to COVID-19 isolation. So if you are one of those seniors in residential care, would really encourage you to look into compassionate care. And certainly those situations can include a decline in overall status due to worsening mental health, worsening conditions of grief or depression, and certainly physical decline. But keep it up, Douglas County. We're proud of you, and we're going to be right here alongside you.
Thank you, Commissioner Layden. And Commissioner Thomas, your final thoughts, please.
Thank you, Dirk. I'd like to thank everybody who listened in today to get some more information about what's going on. I think that when people have more information, they can make better decisions. So I applaud all of you for calling in and listening and watching. You know, I was listening to the phone calls, and there were a lot of people asking about their families and how they could get together with each other safely. The call that really resonated with me was the 71-year-old gentleman who called and said, "Hey, I'm healthy and I want to help others. So how can I do that?" And I think that is the recipe for what has made Douglas County such a successful county, because we are all there to help each other, whether it's municipalities helping each other, the county and municipalities working together, citizen groups working together. That gentleman exemplified the spirit of what is Douglas County. So thank you for listening. I'm sure we'll have another one of these soon. Goodbye and God bless to everybody. Bye-bye.
Thank you, Commissioner Thomas. And on behalf of Douglas County, thank you, everyone, for sharing your time with us. We hope you'll be joining us again for future town halls. Be well, be blessed. Have a great day.